So my presentation is really about decades of research in really replacing parts of the body with viable live cellular replacements. So it's really about regenerative medicine and really evolving from decades or even centuries, depending on how far back you want to go, for man-made implants, repairing and replacing parts of the body that have been damaged or are worn out. And we've moved into a new era where using stem cells or progenitor cells, we can now seriously consider regenerating and repairing parts of the body with the patient's own cells or someone else's cells, and implanting those and providing a new articulating cartilage layer or a new piece of bone without having to have someone living with a perfectly brilliant piece of titanium. They're now back to being 100% themselves and good to go on living a healthy, independent life. So medicine, we're a victim of our own success in medicine. So people live a lot longer than they used to, even though life expectancy now seems to have stalled. Actually, our active lifestyles and what we do in our leisure time means that our bodies, if they don't fall foul of disease and infection or trauma, and even if they do, we tend to be able to keep people alive thanks to medical successes and advances. The problem that's before us now as a species is that we wear out and we start to degenerate. So we're really trying to address those degenerative, so-called aging disorders, and really putting people back just with a bit of a top up, a lift up with a cellular therapy that will give them back that articulating cartilage in their knee so the knee pain goes before they need a knee replacement. The trick now that we're all working on is providing that therapeutic dose and it being greater than 95% successful when it's fired into that body as that treatment. And that's really where we start to embrace a much used term of personalised medicine. So yes, it's an autologous therapy ideally, but it is personalised medicine because now we're actually asking the patient to go on that journey with us and to accept some of the responsibility for taking this living treatment into their body and then looking after it. So what you've done previously is behind you, and what you now have to do is accept that this is a living thing, your own living thing, and just change your lifestyle ever so slightly to allow this the best chance of success.